Salams and welcome to episode number 2 of ADHD. So let's get going. As I mentioned before, we've got 12 episodes to go. We are busy with episode number 2 today. We're going to talk about what is ADHD, some of the treatment modalities, and then I came across a fabulous article in the South African Journal of Psychiatry where we're going to be emphasizing let's remove the stigma around ADHD. So please, the whole purpose of these programs is first to educate ourselves, to help those people, parents who've got children with ADHD, and how we can share knowledge. So the teachers need to be educated, ordinary men and women need to be educated, the employers need to be educated, and just the general public need to be educated. October is ADHD month globally. So let's focus on ADHD, let's all educate ourselves about it, and let's regard it with honor and with dignity. And let's show respect for people who've got ADHD or any other problems. Let's show respect whether you've got diabetes or heart problem or disability or whatever other problems. Don't think that someone else's child is something wrong with him. Oh, my children are perfect. It can happen to anybody. So let's treat people who've got difficulties, whether it's autism, ADHD, or any other mental or other physical or mental or other type of problems. Let's show respect to everyone. As South Africans, we are all good people. Ons almal lekker, braai vlees, rugby, sunny skies, and BMW. And we also add biltong, hot tea, and samosa, and pap and vlees, and everything nice. Right, let's get going. So ADHD, right, so here we said it's a combination of low attention, and high activity. Okay, like a seesaw, right? Low attention, high activity, combination of difficulty paying attention, hyperactivity, and impulsive behavior. What are the causes? How do you get ADHD? Okay, the exact cause of ADHD is not clear, but experts and researchers have got some clues. But the exact cause, they cannot pinpoint it to say, all right, here's a blood test and all right, now you got ADHD. They can't just send you for an X-ray or a brain scan and say, all right, now you got ADHD. Okay, but there are clues. Research efforts continue. Factors that may be involved include, so there's a wide variety of factors. Genetics. First is genetics. ADHD can run in families, and studies indicate that genes may have a role. Maybe the father got ADHD or the mother got ADHD or the grandparents had ADHD, but there's some family link to that. So that's the first thing. Second situation that can cause ADHD is your environment. Certain environmental factors increase the risk. For example, lead. In the old days, we used to have lead in the paint, and there used to be lead on the children's toys. So sometimes the children were eating the lead or playing with lead paint. That can cause ADHD. A pregnant mother who is exposed to lead can also develop a child with ADHD. Problems during development. The third thing. Problems with the CNS at key moments in development may play a role. Okay, so the first, as we said, if you have blood relatives, parent or sibling with the similar problems, or if the pregnant mother, this is very important. So during pregnancy, if the pregnant mother smoked, smoking is a risk, or drank alcohol, or used drugs, or as we mentioned, if she was exposed to lead in any way, then this can increase because there's the barrier, because the mother, whatever the mother consumes, it goes to the baby as well. So the mother is smoking, is as if the baby is smoking. So imagine the baby is smoking in the womb. If the mother is taking drugs, ecstasy or methamphetamine, then the baby is also high on cocaine. And if the mother is drinking alcohol, the baby comes out drunk. So that's what's called fetal alcohol syndrome. So whatever the mother is doing, it's also being happening to the baby. So when the mother is drinking alcohol, she's actually feeding alcohol to the baby. So the baby gets affected, and in the early part, the brain is being developed. Billions and billions and billions of cells are being formed in that critical stage. So we need to be it must be a very pure environment in the womb. It must be as if a total quarantine. You can't put anything wrong into your mouth. So in some cases, even a premature baby, sometimes premature babies also have a greater tendency to have ADHD. The complications. What are the complications or symptoms or side effects if you do have ADHD? ADHD can make life difficult for you. Okay, it can make life difficult for you. And my philosophy, whenever I look at this, I always have the first thing. Even if you don't have ADHD, I always say life is difficult. So in my case, I don't have ADHD, alhamdulillah, but life is difficult. But we say what we say. We say we don't quit. We carry on. So, but ADHD, you got special difficulties not only for the affected child, but also for the parents, the caregivers, the teachers. It's like it says it takes a village to raise a child. In the same with ADHD, it takes a village to understand what is going on, and we need to be sympathetic. And main thing, we need to Let's remove the stigma from ADHD, please. Let's be positive and let's focus on the good things. But ADHD has been linked to certain things. So see if these things fit in with your child. If you are suspecting your child got ADHD, let's see if your child got any of these things. Poor school or work performance, unemployment. The person can have financial problems. This can also apply to an adult. Trouble with the law, legal problems, car accidents, alcohol or other substance abuse, unstable relationships, poor physical and mental health, and poor self-image. Now, there are certain tests that we can do also. If you think that you or your child, if you as a parent got ADHD or your child got ADHD, if you think you got ADHD, attention deficit hyperactivity disorder, the earlier you get the diagnosis, the better it is. It's very difficult to diagnose this in adults. So if you have a child, it's better to, usually the average age for diagnosing it is about 6 to 7 years. But a great deal the parent has got to be educated about it, and the teacher has got to be educated about it. Now, I know we got a lot of problems with our provincial schools where we came last in our reading skills. Globally we had a test all over the world. South Africa came out last. Now, if our children in primary school standard 4 and 5 can't do simple reading and comprehension, we came out last in reading and comprehension, then what does it tell us about the teachers who are teaching these children? So I'm very concerned. I'm very worried about South Africa, because do our teachers, if we have difficulty even teaching our children how to read, do the teachers even know what is ADHD? So please let us share knowledge. The teachers, I feel that it must be compulsory that every teacher must know what is ADHD. So the sooner you can pick it up, the better it is. You communicate to the parents, say, this is the concern I've got. Speak to the psychologist. There must be a psychologist on the school premises, or there must be access to a hotline or a consulting line. So we need to see how we can engage with the government and say we need more money, we need more resources, we need more better care for people with ADHD, and we need to remove the stigma around this condition. Please, let's we all share knowledge. Let's make South Africa and let's make the world a better place, because living with ADHD is very difficult, and it makes it even more complicated if people don't understand it, and then they criticize and they mock the people, and they have a stigma associated with it, and then the parents are even shy to talk about it. No, I don't know what's going on with my child. No, how can we have that type of thing? We need to embrace our children, need to hug them. It's not their fault. It's not their fault. So we need to remove the stigma around it and see in what way, with compassion and with kindness, how can we help the people, both the patient, as well as the family, as well as the caregivers, as well as the teachers. So there's no single test to diagnose ADHD, a common brain disorder, right? Sometimes people are diagnosed when they are adults, after years of not understanding their symptoms. Some people, they just grow up, no one understands what they are going through, and they're suffering in silence. It affects their self-esteem. They become withdrawn. They don't want to socialize. Either they will become withdrawn or they'll become very angry. Why are you talking to me like that? So they become very defensive, because they get because people are not understanding what they are going through. So we need to be compassionate and kind with these people. So it takes a series of observations and evaluation with doctors, with ADHD experts, with teachers and professionals to confirm the diagnosis. And ADHD screening is a detailed process that may involve interviews with adults who interact with the children, personally watching the child, questionnaires or rating scales that measure the symptoms of ADHD, and psychological tests. So you need to get psychologists and psychiatrists involved, and that's why, as what I mentioned, this fabulous article by Dr. Skuman and Dr. Vogus, the South African Journal of Psychiatry, called ADHD Stigma, the Silent Barrier to Care, and we will go through that article. And that emphasizes a lot about that's removing the stigma. So your doctor needs to see how much your child's symptoms affect their daily moods, their behavior, the productivity, and the lifestyle habits, and they need to rule out other conditions, because sometimes you can have other conditions that seem similar to ADHD, but they are not ADHD. So we need to differentiate that. When can you test for ADHD in children? What is the right age? There isn't really a right age. It just depends when you pick it up. But you can have ADHD evaluation as early as the age of 4. And in many of these advanced first world countries, that's how they pick it up very quickly, because they've got the resources, they've got the money, they've got the funding behind it. Some personal problems and other concerns can also cause symptoms mimicking ADHD. Okay, so that's very important to differentiate the two. So the screening should take into account these factors which are not ADHD. So some of these, I'm going to mention a list of these things. These are not ADHD, but they are similar, so you can get confused. So I'm going to give you a list of those things which could not necessarily be ADHD, but that you got to speak to your doctor or the ADHD expert. So short attention span, that's pretty normal. Okay, some kids can't focus as long as others. Okay, so no need to panic or freak out about it. Emotional issues, some kids feel anxious or sad, they may have trouble paying attention. No big deal. Maybe they got a problem at home, maybe they wanted pizza and they got a hot dog, maybe they're just upset for the day. So that doesn't mean it's ADHD. Maybe they got problems at home. Children who are having a crisis at home, maybe their parents are going through a divorce, or maybe there's an illness at home, maybe grandpa is not well, and then they got some certain problems. That does not mean it's ADHD. They may be a bit withdrawn. You'll see, hey, you know what? The teacher may say, hey, this kid is a bit down. Got ADHD. No, let's not jump to conclusion. ADHD is a precision. There's a way to diagnose it. You could do full questionnaires. They've got to fulfill certain criteria. So let's not confuse that. And sometimes classroom chaos is normal for children to be a bit naughty. If a classroom is noisy and purely managed, a child's attention can wander from the task. The other kids are playing, so he'll look at them, he'll daydream a bit, but it doesn't mean he needs medical care. It doesn't mean I must throw tablets into the child's mouth. Especially when it comes to children, try and avoid popping pills into the mouth. First, try behavioral intervention. First, get an accurate diagnosis before we start. We've become a pill-popping generation. So that brings us to the end of today. This is episode number 2. So just a brief episode number 2. Join me for episode number 3. Stay well and look after yourself. And let's get knowledgeable about ADHD. Please share this with others. October is ADHD Awareness Month. Let's share and let's make this a better place. And let's look after the people with ADHD. And let's remove the stigma. Remove the stigma from ADHD. Why? Because we care about people and we care about our patients and we love everyone. Stay well. Look after yourself. Alhamdulillah.